Good morning and welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Good morning, everybody. I'm Rhonda Lahnert.
And I'm Chuckalicious Chuck Williams.
It may surprise you to learn that each year tens of thousands of people in this country are diagnosed with HIV worldwide. Roughly 39 million people live with the disease. Researchers and scientists are studying HIV recently attended a global summit to share their latest findings, including a new interim clinical data suggesting the benefits of long-acting therapy for people who struggle with taking daily pills. Here to talk about this important finding and how they may help address an ongoing need in the HIV community is Dr. Harmony Garges, Chief Medical Officer for ViiV Healthcare. Good morning, Doctor. How are you doing today?
Good morning. I'm doing well. I hope you are.
Thank you, ma'am.
Well, one of the questions that we wanted to ask you is, what is the current status of this HIV epidemic? I remember years and years and years ago, it was everything that we were talking about. So where are we now?
Well, HIV is still an ongoing epidemic, even though we've made tremendous progress since the early days. You mentioned 39 million people globally living with the disease, 1.2 million living with HIV in the U.S. And in your area in Texas, 100,000 people living with HIV. And additionally, more people are diagnosed every year. So roughly 36,000 new diagnoses of HIV in the United States every year, which translates to roughly 4,600 new diagnoses in Texas every year.
You know, HIV is no longer an automatic death sentence. There's been a heck of a whole lot of progress made since the 80s. Can you go into some of the progress that we've made to keep this from being the death sentence?
Absolutely. We've had tremendous advances in HIV treatment. As you said in the beginning, we didn't have any effective therapies. Then we have medicines, but they required complicated combinations of a large number of pills. And we've evolved to where we are today, where most people can be treated with one pill once a day. So that's tremendous. But it's also important to highlight that taking a pill every day is very difficult for some people. And in the United States, roughly a third of people struggle with taking those pills every day. And your HIV medicine isn't going to work if it's not taken regularly. So it's still a really important option that has to be addressed.
At that conference, you talked about that, and that was one of the findings about people struggling to stay on their regimen of pills. What could the data from that conference mean for the HIV community?
So that's right. The conference showed that one of the large U.S. clinical trial groups presented really positive interim data showing that our company, ViiV Healthcare's long-acting injectable Cabenuva, given once a month, could be even more effective than daily oral pills with a similar side effect profile outside of injection site reactions. And so that really speaks to how long-acting medicines can really address an unmet need for people in the community who need a different option outside of pills.
Well, what can you tell us about maybe what was discussed at the conference about new options for treatment?
Right. So in addition, there was a lot of data looking at what's the next generation of medicines coming through the pipeline. And long-acting therapies are definitely an area of interest. And we were able to also present data looking at our next generation of long-acting medicine. So a medicine that could potentially be given only 3 times a year. So someone could get 3 doses of medicine in 1 year and keep their virus suppressed. So definitely lots of great research in HIV, both treatment and prevention, and how long-acting therapies can really play a role for people in the future.
What can you tell me about the additional data evaluating the new HIV treatments?
So there was a lot of excitement about these new data that were presented, again, looking at current long-acting therapies as well as what might be coming in the future. And I think for the community, there was such excitement over this because, again, we know some people really struggle with taking their pills every day, and these long-acting regimens can meet an unmet need. And what this will allow people is to keep their virus suppressed, which will help their own health, optimize their own health, but also help to ensure that they can't pass HIV on to others. So again, just a lot of excitement coming out of the conference, all focused on long-acting HIV therapies.
Last question for you, Doctor. What's the takeaway you'd like to leave with our audience and to remember about HIV and new treatment there?
Yeah, a couple takeaways. First of all, HIV is still really important, and so I'm so glad we had the opportunity to talk about HIV and the treatments that are available now and some of them that are coming in the future. If anyone has interest in this, is curious about it, I'd encourage them to please go talk to their doctor, see if this therapy could be something that they could benefit from. And certainly they can go to our website to learn more about our long-acting regimen. That website is cabenuva.com, which is CABENUVA.com.
Dr. Garges, thank you so much for your time and this information. Like I said, in the generations we grew up in, HIV was a death sentence.
Yes.
It's not anymore. It's treatable, and there are people out there working hard each and every day to address it, take it, and it's not gone. I think sometimes it's not in the news every day. We forget about it, but it is still severely impacting people across the world. And thank you for your great research, Doctor, and thank you for joining us this morning.
Thank you so much for having me.
If you need more information, you can check out cabenuva.com, or you can go to Vive Healthcare and find out how to battle this.